Hey, what's good, you guys? Welcome back to my channel. My name is Pulani Dube, but on here I call myself Miss Educated Rambler, making use of my nursing degree and coming on here to educate you guys on some things and maybe ramble once in a while. so today I just thought I would come on and share answers to questions that I have been asked before by some patients in the past, or questions that I still get asked to this day, because people know I'm a nurse graduate, so they feel like I know everything. And guys, I don't know everything, but I will try to answer some questions here today. I just came up with 3 questions, and if there are any other questions that you would like answered, please drop down in the comments and let me know, and I will answer you. Alrighty, let's get into it. So one of the commonly asked questions is, can I take my painkillers on an empty stomach? And the answer to that is yes, you can, but not with all of them. Some, only with some. You can take painkillers like paracetamol, opioids, which are your morphines, right? You can. The thing with the opioids, though, is that they have a side effect of giving you like nausea, okay, where you feel like vomiting. So it's good to take those with food for that reason, to lessen that effect. And then the painkillers that are not good to be taken on empty stomach are your NSAIDs, for example, like the aspirin, the ibuprofen, which a lot of girls know of, right? The ibuprofen usually given when you're having your cramps, your monthly cramps. So those ones, you have to make sure that you eat something, because they have this thing of irritating your stomach lining. And if that is irritated, then you can experience ulcers, you can experience internal bleeding as well. And also make sure that you take them with a full glass of water or milk. And then another thing is, some people don't feel like having a full meal before they take their medication. That's fine. Just make sure that you at least have something small, something that has low acid, right? So you can take a banana or two. You can take plain toast, right? Something really small, like I said, just make sure that it is not acidic. The next question that some people tend to ask is, can I take my painkiller with coffee? We just addressed this. Make sure that you don't take anything acidic with your painkiller. The thing with coffee, however, is it's good in that it helps to absorb the medication into your system quicker, right? Because of the fact that it is acidic. But the long-term effects would then be the irritation, because I get a thing. The coffee is acidic. Your stomach is also acidic. So if the acidity is increased, you know what I mean? You can imagine how corrosive that can be. So you can end up having the bleeding that I mentioned before. Okay, but like I said, coffee does increase like absorption of the medication, but kind of wait a bit. Like, can't you just wait 2-3 minutes for the medication to be absorbed into your body, rather than crying because of the effects that they come along after a while because of practicing something that you could avoid? You could just take water or milk. Okay, and then the last question that people commonly ask is, why do I have to finish my antibiotics? The course of it. So say you go to the clinic and they find that you have pneumonia, right? And then they say, okay, we're going to give you these antibiotics, but take them in 5 days. And instead of taking them for 5 days, you take them for 3 days. The bacteria in your body is not fully flushed out. You might feel like you're better. You might feel like, I'm good. But there are some bacteria that could be babies, just for the lack of a better way of explaining. They are not as active, they are not as smart as the ones that would have maybe been killed off. And so when you give them that break and they wake up from this sedation, because I get the medication like sedates them, kills them off, and all of that. So when they wake up and they realize, okay, this medication has now stopped coming in, it's now weaker in the body. They wake up, they start to multiply, they start to grow a resistance, they figure things out and all that stuff, right? So then you find that you get sick again. And then, yeah, they're like, how about kanjan, right? It's because you would not have taken your medication for 5 days. Figures. So in that situation, don't panic. It's advised that when you remember that you didn't take your medication, as soon as you can, take it, but go to your local clinic or call your doctor and ask what the next course of action should be, what you should do next. So yeah, that's just a quick summation of the whole thing. If you want me to go any deeper with that one, please let me know. And like I said, if there are any other questions that you'd like me to explain, like a girl, just explain. I'm just a girl, guys. I'm just a girl, and I'm just trying to make the most out of my time. And yeah, so I hope you enjoyed my explaining, and please stay tuned for next videos to come. Thank you so much for watching. See ya. Bye.